Hi, how are you? I'd like to start off by thanking you for being here tonight. The things we're going to talk about are children with ADHD, the struggles they may encounter, and what treatment options may be available to them. Research suggests that a child with ADHD can significantly improve his or her academic achievement through diet and behavioral treatments. Some of the things we're going to touch on tonight are: what role does an ADHD child's diet play in their ability to function academically, and what changes can be made to their diet to help them better achieve academically? The second thing we're going to touch on are: what benefit do behavioral treatments have on a child with ADHD, and what techniques can be implemented? ADHD is a disorder that affects a child's ability to concentrate and stay focused. Children with ADHD have difficulty finishing tasks, following directions, are very impulsive, and have an excessive amount of energy. According to a study by Dr. Haber, a child with ADHD is at a high risk for school failure and dropout. As many as 30 to 50% of children with ADHD are retained at least one time throughout their schooling. These are very high numbers. If a child is faced with the added challenges in school with ADHD, are they doomed for academic failure, or are there treatment options available to them? The first point that we're going to talk about is diet. Eating too much sugar may be displacing the essential minerals and amino acids in a child with ADHD. Essential fatty acids are crucial for children with ADHD because without the proper amount, visual problems, infections, impaired growth, excessive thirst, and most importantly, learning disabilities can be triggered. Children with ADHD experience greater problems when missing breakfast. Breakfast is the most important meal of the day for anybody, but especially important for a child with ADHD. The most important thing to incorporate in an ADHD child's breakfast are proteins. Proteins are very important because they maintain steady blood sugar levels. This prevents the ups and downs associated with mood swings. It also provides the proper brain function, important for children maintaining attention. Children with ADHD have very small attention spans. So as you can see, by simply changing and altering a child's with ADHD's diet, you can significantly change how they start their day in school and how they achieve academically. The second thing we're going to talk about are behavioral therapy. Behavioral therapy is essential for ADHD treatment and should be implemented as soon as a child with ADHD receives the proper diagnosis. It will help them to properly deal with the everyday struggles that they may encounter. An effective tool used in behavioral therapy are behavior charts. These charts help a child to learn organization and routine. It's crucial to have a behavioral therapist assess a child with ADHD to diagnose any learning disabilities. These learning disabilities may occur within spoken language, arithmetic, reasoning, problem solving, organization skills. Behavioral modification addresses the problem behaviors by structuring time at home, establishing more predictable routines, and increasing positive attention. What I'm going to show you here is my behavior chart. This is my visual aid. On the left, it lists the different tasks for the child, such as brushing teeth, getting dressed, combing hair. Seems simple for a child, right? Well, not for a child with ADHD. If they're having trouble with structure and following directions, this is the perfect way to implement it into their schedule. We have a 7-day week with a reward at the end. If they complete the task, they get a star. Each star is worth 2 points. If they do not complete the task, it's a -2 points. There's a possible point value of 94 points. In this particular behavior chart, they must reach at least 84 points to obtain, in this case, their sleepover. The points obtained in this chart was 86 points. If they did not reach their goal of at least 84 points, there are negative consequences. In this case, no play dates with friends, no Xbox 360. What this shows is instant gratification, which is necessary for a child with ADHD. This is shown to be the most effective treatment because of the immediate gratification. The child knows what his or her tasks are because they're specifically laid out for them. So by seeing it on paper, they can structure their day accordingly. So what we talked about today were the different roles that an ADHD child's diet can play in their ability to function academically, and what changes can be made to their diet to help them achieve better academically. We also touched on behavioral treatments and what techniques can be implemented. Research suggests that a child with ADHD can significantly improve his or her academic achievement through the combination of diet and behavioral treatments. This is what we talked about today. As you can see, by making small changes to a child's behavioral treatments or diet, you can significantly reduce the symptoms of ADHD. Does anybody have any questions?
Is one treatment appropriate for every child?
There is not one specific treatment for every child, and every child needs to be treated case by case. Every child's degree of ADHD is going to be different, their symptoms are going to be different, so every child needs to be treated accordingly. Any other questions?
Will a child's medications or dosage ever need to be adjusted?
The continued success of ADHD treatment relies on parents, teachers, and doctors constantly evaluating and monitoring a child that is on any ADHD treatment program. So yes, it's going to have to be, the dosage could change as the child grows. They may need a higher dosage. If they're not responding correctly to a medication, they may need to be changed. Their medication may need to be changed. So yes. Thank you for listening to the presentation, and have a good night.